Degraders are a new class of drugs that are in early development, particularly phase 1, and one of them is a little bit further in advanced than the others in moving into phase 1b, phase 2 expansion. The degraders bind to their target, which in this case it's Bruton's tyrosine kinase, which is an intracellular protein in normal B cells and also in CLL cells. And when they bind to BTK, there is a mechanism by which the protein is ushered, it gets ubiquitinated, and it is ushered to the proteasome, and it gets eliminated or degraded through proteasomal degradation. And so it is a way of depleting Bruton's tyrosine kinase in the cell, particularly CLL cells in this case. And that's in contrast to the inhibitors, which we've had for several years now. And those inhibitors bind to BTK, but they block the enzymatic activity of BTK without necessarily affecting the protein levels. So the inhibitors will either covalently or non-covalently bind to BTK, and when they bind to BTK, they block the kinase activity. And for both the covalent degraders as well as the non-covalent degraders, essentially the cells need to make new BTK in the absence of the inhibitors in order to restore BTK in the cells. And that's in contrast to the degraders, where they certainly have to make new protein. The cells have to make new protein in order to replace what has been degraded by the degraders. All the drugs that we have in this category, the inhibitors as well as the degraders, are oral agents, small molecules that are administered and taken orally. So there are multiple degraders that are currently in development. ABBV-101 is one of these degraders. The degraders are at various stages of development. ABBV-101 is currently in dose escalation, dose finding for that drug, and there have not yet been any formal reports at meetings, early reports of activity or of side effects and toxicities. But the company is working on a multi-center trial that is enrolling patients and is going through the dose escalation phase. There are other degraders that have been studied and have been reported on. So the Nurix compounds, there are 2 degraders that Nurix has been working on, NX-2127. That was the earlier molecule that had a dual degrader function. It degraded both BTK and cereblon. And then their more recent version, a newer version, which is a pure BTK degrader, and that's referred to as NX-5948. The other degrader that's coming along in development that's been reported, in fact, at ASH this last December, is the Beijing compound. That's BGB-16673. That is showing activity and is relatively well tolerated. Both of the degraders that have been reported in the literature or at meetings have activity in treating CLL and have a fairly good toxicity and tolerability profile. Because they're all in early development and the patients who are enrolled on these clinical trials are previously treated, most of them are heavily pretreated, it's difficult to make efficacy comparisons because of the patient populations. And so we can't really make statements about differences in efficacy and activity. They're also, because they're heavily pretreated patient populations, we can have a general idea, a comparative idea about side effect and toxicity profile. We have not seen any data where there are safety concerns or unique or intolerable toxicities associated with these agents. There were some early reports for the NX-2127 compound of some neurotoxicity and atrial fibrillation, and so they stopped developing NX-2127 in CLL. It is being developed and has been better tolerated in other B-cell malignancies, and that is why they have moved forward with NX-5948, because it is a pure BTK degrader, and those toxicities that I mentioned for NX-2127 have not been as prominent for the NX-5948. But they all seem to be relatively well tolerated. They are working on finding the maximum tolerated dose or the maximum active dose. And so we'll hear more about comparative efficacy and toxicities as we get more patients who've been treated with these agents and we have more data to evaluate. We do see some similar toxicities as with the inhibitors, for example, increased risk for bleeding, bruising. That has been a common theme across these agents, both the degraders and the inhibitors. But we haven't heard much about reports of atrial fibrillation and cardiac toxicities that have been a concern with some of the inhibitors, particularly that's been associated most prominently with ibrutinib, the atrial fibrillation. And so I'm optimistic that they will be well tolerated, and I'm looking forward to using them in combinations because I think they will be very effective in combinations as well. The degraders are potentially important. Theoretically, we'll see if there is a basis for the observation and what I'm going to say. But I'll give you an example with the inhibitors, both the covalent and the non-covalent inhibitors. We see mutations in BTK as a mechanism of resistance or associated with resistance. For the covalent BTK inhibitors, it's predominantly C481 mutation. For the non-covalent, there are others that are more prominently associated with resistance. Now, these mutations don't allow the inhibitors to bind to BTK, but we do know that there is one mutation that is referred to as a kinase dead mutation. This is a mutation where the inhibitors can bind, but the protein, the mutation actually the inhibitors don't bind. The mutation actually, in and of itself, will block the kinase and function of the BTK. So the mutation renders the BTK inactive, but the BTK molecule can still participate in what's called scaffolding, where these molecules, particularly BTK, are part of a signaling pathway. And so in order for the signaling to be transduced and the pathway to be active, the proteins need to come together, associate, and when they cluster and scaffold, they are able to interact and to transduce the signal. So we know that BTK, the protein itself, can function in that scaffolding, and you can still get signaling even if BTK is not enzymatically active. And so that is what's referred to as a kinase dead mutation. As you realize, if it participates in scaffolding, and that's important for continued signaling, then if you degrade it and completely eliminate the protein, then there is no BTK to participate in scaffolding. And so that may be an additional mechanism by which these agents are more effective than the kinase inhibitors, because they completely eliminate the protein and will also potentially disrupt the scaffolding and add another component to inhibition of the B-cell receptor signaling pathway.